Hi everyone, I welcome you to another teaching on medical consumable. My name is Adebayo Christopher Adedonyi. Today I will be discussing endotracheal tube, but under the following subheadings, which are the introduction and use, features or component parts, the types, how to determine the size to be used on patient, and the practical demonstration of the product. Now, without wasting much of the time, let's go straight to the introduction and use. When you hear the word endotracheal tube or endotrachea, what comes to your mind? There are two basic words there, which are endo and trachea. The word endo means anything that goes inside, while the trachea is a part in the human respiratory system. And as we all know, the human respiratory system is on this wise, which are the mouth, the nose, the pharynx, the larynx, the trachea, the bronchus, the bronchiole, and the alveoli. The alveoli is the part through which the exchange of gases takes place between the lungs and the blood. So, but this endotracheal tube lies within the wall of the trachea. And what does it do? The endotracheal tube help in ventilating the patient during intermittent positive pressure, or you can simply put, it's a medical device that help in securing the patient airway during intermittent positive pressure ventilation, IPPV. So that is the major function. It can either be rubber or plastic. The plastic type is what we call the non-reusable type, or we call it the single patient use. Why? Because it can only be used once, and it is made from PVC, polyvinyl chloride. While the reusable type or the rubber type, we can reuse it after first use, meaning it can be cleaned and autoclaved after first use, thereby making it available for the next patient. But lately, after the advent of the COVID-19, I have not actually seen any of these reusable products anymore. Either as a result of the fear of the virus, I really don't know. But what I discovered that most of these consumables that come nowadays, most of them are non-reusable type or the single patient use. Alright, without wasting much of our time, let's go straight to the features or component parts. This is the endotracheal tube that I'm talking about. This is the tube. So, and this is the curved type. This and that tube, this one we call it the uncurved type. If you check, there's a difference. This one is curved, while this one does not have curve. But I will explain all of these things later on. So also I have another one, which is the reinforced tube. So we call this one the reinforced tube. If you check, this one is flexible. Though I will also explain all of these things at the later on. But they does the work of ventilation. But they do it. But they are slightly different from each other, of which I'm going to explain it later on. So now, if you check too well, it has various components, which are, this is the connector. The connector can be removed. So this is the connector. This is the sorry, I think for proper view I have a one on my slide. Let's go straight to the slide, and so that you'll be seeing it as I'm explaining it. This is it. But meanwhile, before I go into it properly, let me show you the rubber type. This is the rubber type, and this is the one that I call the reusable type. So this is the curved, and this is the uncurved. So this one can be reused on multiple patients, or we call them the reusable type. While this is the plastic type. So this is the curved type, and this is the uncurved. So now these are the various components, and mind you that all these various parts has a specific functions, of which I will explain them to us one by one. This region, we call it the connector. This is the connector, and if you look at it very well, it has a particular line that run vertical or that run vertically or that run from the proximal end of the tube down to the distal end of the tube. It also has its own function. We call it the radio opaque line. We also have another part which we call the self-seed valve, or some people call it the one-way valve, the self-seed valve. While here we call it the pilot balloon. This is the pilot balloon. While if you look at it very well, it has horizontal markings. They also have their function too. So this region we call it the curved. As I've showed to you earlier that there are some tubes that don't have a curve. I will also explain them. While at the distal end of the tube has two openings. One is big, while the other one is rightly at the back of the of the big openings. We call it the muffin eye. The larger opening we call it the beaver tip. I will explain them to us one after the other. Now let's go back to the video so that you see so that I will explain it with the one that I have here. So this is the tube. Now what are the functions of all these components? This is the connector. The connector helps to connect the tube to the anesthetic machine through the breathing circuit. But before the breathing circuit is being connected to it, there is another device which we call the HME filter, the heat moisture exchanger. So the HME filter help to filter the air and help to humidify the air that is being given to the patient so that the air will not be dry. And this is the function of the upper respiratory system of human. You know, the upper respiratory system of human being perform two functions, which are the humidification of the air and also filtering purposes. So meaning each time we breathe in, our upper respiratory system help to filter and help to humidify our air. Now since the endotracheal tube goes directly to the trachea after intubation, thereby bypassing the upper respiratory system, let's ask ourselves, what now do this work, or what now perform this role of humidification and filtration of air? It is by attaching this HME filter to it. Alright, now let's go straight to the radio opaque line that runs from the proximal end to the distal end. The major function of it is to determine the position when view the tube through an X-ray machine. It helps to determine its position, because when this tube is being viewed through an X-ray machine, the tube will not be seen, but through the radio opaque line we can know the position or determine the position of the tube. The horizontal markings help to determine the depth of insertion, while the curve help to maintain an airtight seal between the between the tube and the wall of the trachea. As I told you before, that the distal end of the tube has two openings. One is big, while the other one is rightly at the back of the tube. It's just at the back, it's at the left side. So as you can see, it's at the back of the tube. So the big tip, we call it the bevel tip, is slanted. So what does it do? It helps in ventilating the patient and also help it also aid easy insertion through the vocal cord into the trachea. But sometimes the bevel tip can get occluded, either as a result of blood or secretions, or by coming in contact with the wall of the trachea. So by this three means, the bevel tip can get occluded. When this happens, immediately the muffin eye take over the function of ventilating the patient immediately. So these are the various components of this tube. Now, what are the various types? Let's go straight to the types of the tube. What are the types of this tube? Basically, I will classify the type into two. We have those ones that are frequently used in the theater, while we have some that are meant for special cases. I mean, they are not frequently used. So I will list them out, but I will not dwell much on it or on them. We have the Oxford tube, we have the polar and ray tube, we have the microlaryngeal tube, and we have the laser resistant tube. So these are the tubes that are meant for special cases. They are not frequently used. But the ones that are frequently used, there are three. We have the uncurved, we have the curved, and we have the reinforced tube. This is the curved type. This is the curved. I don't know whether you can see it very well. So this is the curved. I'm trying to show it from the slide. This is the curved. I'm coming. Let me show it to us using our slide. Alright, this is the curved type. So the curved type is mostly used on adult cases or during adult cases. As when there is an adult or when there's a case that relates to an adult, so the anesthetic will request for this type to be used. Why? Because in the adult respiratory system, the narrowest point is the glottis, and the shape of the glottis is hexagonal, meaning it has a six angles. Yes, 1, 2, 3, 4, 5, 6. It has a 6 angles. So the tube that can properly fit in, thereby sealing up the the part of the trachea, is when you use the one with the curve. And that is the reason why the anesthetic will request you to supply this for that case or for adult cases. Please don't forget that the curve can either be low volume to high pressure curve, or high volume to low pressure curve. It's of two types. Alright, this is the uncurved tube. The uncurved tube is mostly used when dealing with pediatric cases. Why? Because in the pediatric breathing circuit or breathing system, their system is not that developed compared to an adult, and in order to prevent the post-extubation subglottic oedema, the anesthetic will request you using this for that case. And secondly, to create a small link around the wall of the trachea, this is being used. Alright, so we have another one which we call the reinforced tube or the armor tube. This reinforced or armor tube is mostly used by ENT surgeons, as in during ENT cases, ear, nose and throat. Why? Because if you look at it very well, it has a spiral wire around it. It has a wire that is lying inside. If you check it, it's flexible. It is flexible because during ENT cases, sometimes the head can be rotated or the neck can be flexed. So during this process, the tube will not get occluded or get kinked. But when you use the others that are not as flexible as this, when the head is being rotated, the tube can get blocked. So when the tube gets blocked, it will disrupt the flow of medical gases to the patient. So that is the reason why the anesthetic will request you preparing for this during that part of case. Now let's go straight to the next slide, which is how do we determine the size to be used on patients. In order to determine the size to be used on patient, we make use of this formula, which is 4 plus age of patient divided by 4. And please don't forget that the curved tube, the size is ranging from 4.5 millimeter to 10.0 millimeter, while the uncurved, which is used for pediatrics, the size is ranging from 2.5 millimeter to 7.0 millimeter. But of recent, a friend of mine told me that we now have 2.0 millimeter, but I've not seen. All right, while the reinforced or the armored tube, the size is ranging from 4.5 millimeter to 10.0 millimeter. It is measured in millimeter. So these are the process through which the size can be determined. So now let's go back to our formula. Let's take example. A 20 years old adult is going for is going for surgery, and then you are asked to calculate the size to be used. It is simply 4 plus 20 divided by 4. And when you divide the 20 by 4, what do you have? You have 5. So 4 plus 5, you have 9. So it means the patient might likely use 9.0 millimeter. But while preparing for that case, you prepare for 3. So since it's 9.0, so you prepare for 1 above and 1 below. So you make available so you get ready 8.5 millimeter, 9.0 millimeter, and 9.5 millimeter. So the anesthetic determine the one to use. Now let's go straight to the practical demonstration of the product. So please, mind you, I will not go into deep when talking about the practical demonstration. So what are the things that you need? First of all, you need the tube. This is the tube. So you need the HME filter. You need the breathing circuit. This is the breathing circuit. You know, we have many of these breathing circuits. So you can either use this or you use this. You know, we have there are plenty. We have a closed circuit. We have a semi-closed circuit. We have open circuit. We have semi-open circuit. So there are plenty. So you determine the one that your machine can fit in. So this is closed circuit. So you need this, and you need the either 10 ml syringe or 20 ml syringe, and this is the laryngoscope. So these are the things you need for its insertion. So now, how do we go? This is the tube. So as I've told you before, that this goes straight to the patient, or this goes inside the trachea. So when be connected, this is how it will be. This is the HME filter, and this is the breathing circuit. It can be extended, can be so. These two parts goes to the machine, go to the anesthetic machine, as it ventilates the patient, while here goes inside the trachea of the patient. So this is how it's being connected. So this is it. So thank you. I've come to the end of the video. Thank you for watching. But meanwhile, don't forget that this is what I do. I supply all these consumables to hospitals in Nigeria. So in case maybe you are in need of any of this, you can contact me. Thank you for watching. See you in my next video. God bless you.